Hi everyone, my name is Veronica. I'm a posture and mobility coach, and today we're going to be talking about lower back pain, and we're going to be doing a lower back release protocol. So first, I'd like to talk a little bit about the reasons for lower back pain from the postural point of view. Of course, it's important to know that everybody is different. There's always exception from the rule. First thing that I recommend to do is to see a doctor, especially if you're experiencing acute lower back pain. Especially if it's related to an injury, some trauma. It's good to exclude conditions like osteoarthritis, osteoporosis, spinal stenosis, or disc herniation, because these kind of conditions require special attention and special healing process. It's a whole different protocol for recovery and rehabilitation of this muscle, of that part of the spine. Here on this channel, we're working mostly with chronic pain that's caused by dysfunctional movement, and our main goal is to find out which neighbors in this chain are responsible for this pain in our lower back. So usually it's not back itself. That's why doing tons of hyperextensions, Superman exercises, reverse hyperextensions with the weights at the gym is not the way to fix your lower back. So the first most common reason is lack in the hip mobility. And the best test to see if this is the case would be getting into a deep squat, getting into a malasana pose, and seeing if you get this winking in your bum. So let's do it together. So if we go down in a deep squat, usually you would get a wink at the bottom as you come lower. Or if you get into malasana, you're unable to bring your hips back. So that would be a sign of lack of the mobility. If you're unable to get into malasana position, that also would mean that. So what we're going to be doing today, let's do a standard shin box exercise with a few progressions. So how we get to this position? We're gonna put our feet on the side about 45 degrees and bring our knees to one side. Right now, let's adjust the angles. Make sure that each angle is 90 degrees. Pressing knees to the floor. So flexing the feet. So we have 90 degrees on angle for both of the knees. And let's lean backwards, keeping the feet where they're at. We're gonna move our knees to on another side. Slowly prepare our nervous system because we're gonna move into our progression in a second. Let's do one more. And the last one, we're gonna stay in this position, shift weight forward. Right now, we're gonna keep our elbows up, making sure that we don't overextend too much. The spine is a neutral pose. We're gonna do this exact exercise, but with core activated. So if you feel like there's a lot of tension here on the side, that means the muscle called Quadratus lumborum, it's this muscle right here. It's a part of the lower back. It means that it needs some extra attention, and this is what we're going to be doing next. Let's do a couple more times. And the last one. Perfect. Let's come back where we were. Keeping the same position. Adjusting the angles. If you feel like you bend your knee too much, bring it back out, flex both feet, sitting up straight. What we're gonna be doing after we switch into our side, we're gonna come down, bring the chest down. Here, actually, we can overextend our back and bring chest down to the knee. Exhale on the way down. And come up. Perfect. And let's switch this side, do the same on another side. So this is going to be the movement. Exhale down. You don't have to come all the way because you would have to sacrifice your form. You want to feel this nice pull in your glute. So even if you come just for 45 degrees, that's perfect. Just want to make sure that it's our glutes that are getting the stretch here. Perfect. Let's do one more on each side. And exhale on the way down. Coming back up. I'm not going too low on purpose. I really want to show you this form of my lumbar spine. Make sure there's no rounding at any point. Perfect. And let's do one more on each side. I feel like this movement will get a good release. It's really needed. And the last one. Exhale the way down. Perfect. So again, if you felt the discomfort after you shifted your weight forward and you were unable to hold yourself here, the muscle that one of the most neglected muscle is Quadratus lumborum. I'm going to attach the picture of this muscle so you understand. So this is a square muscle located right on our lower back. Reasons why we don't really use this muscle in our day-to-day life is because we usually move our bodies, usually it's a front motion, back flexion, back extension, not even so much. So usually, yes, we in a constant flexion position, sometimes in extension. We very rarely moving in a lateral ways, and this is where the muscles is engaged the most. That's why side bends, if you notice in all my YouTube videos, in my courses, we're doing side bends and different variations of it all the time. So let's do it right now. We're gonna get into a mermaid pose. Knees about 30 degrees angled, both of them. Let's shift our weight from one hip to another hip. Perfect. And what we're gonna do, we're gonna come to the side, do a side bend, but we don't wanna go too low. The common mistake that people bring their shoulders up, when they keep shoulders disassociated. We don't want to go too low. We want to make sure that we're staying in one plane of motion. So there's no overextending in the back. The spine is neutral. The core is activated. So even if it's going to be just till here, that is just enough. We don't have to fall too low. And we're going to go for 10 reps. This side is always a bit awkward. Perfect. Let's add breath every time we go down. We expand the rib cage. The point is to open up the rib cage. Perfect. We are ready at 4. To breathe through your nose. Remember that the range doesn't have to be too far. Let's do a couple more. And the last one, keeping the shoulders down, coming back to center. Beautiful. The next exercise, which is, I think, the most important one, we're gonna be releasing our glutes. And now let's do another side. So we're gonna put our legs in a 30 degrees angle, both of them. Shift the weight from one hip to another. Leave it somewhere in between here, and we're gonna continue with the side bends. Remember that we don't have to go too far. Add in the breath, inhale. making sure to keep your shoulders down. I feel like I just lifted my shoulder. And one more on each side. Expand the rib cage as if somebody's pulling you apart. Yes, like that. Perfect. And the next section of the exercise is going to be 3 exercises. Are going to be all about our glutes, our release of the glutes, and activation. So usually people with lower back pain experience a lot of tightness in their glutes, and that's mostly because they are weak. So our glutes tend to compensate, and what I like to do, I like to remove this tension of the glute, doing some deep stretching. We did a little bit at the beginning when we were doing this folds with shin box exercise, but we're gonna do it once again with a pigeon pose right now. Then we're gonna activate the glutes. I like to do a few resistance exercises for that section. And at the end, we're gonna do a myofascial release to release the tension from the glute once again. So let's start in a pigeon pose. This is a classic yoga pose on. So we're getting into the pigeon here. If you're unable to reach the floor and sit into it, let's start actually with a dynamic pigeon. So you bring the weight on that hip that's at the front. And what we're gonna do, we're gonna keep that contact with the floor and shift our weight to the middle. Perfect. It's almost like you're trying to bring that left hip into the floor, because we want to have our hips square to the side. So we're gonna go for 8 more. Remember to breathe. 2, 3, 4. It's like a nice pulling sensation in your right glute right now. 6, 7, and 8. Perfect. And let's stay in that spot, that tough spot in the middle, and let's lower down on our elbows, trying to maintain that straight back posture. And here we're just gonna take a few intentional deep breaths. Moving up. Breathing into our hips. It should be a feeling of a nice release in that glute, the one at the front. Let's take this one last deep breath in. And let's switch this side. Let's bring our left leg at the front. Again, the angle here doesn't have to be too open, whatever you're comfortable with. All I want you to do, I want you to be able to reach that spot where both of your hips are square and forward. So even if you can reach this spot only for a few seconds, that's totally fine, because we're doing the dynamic pigeon. So again, we're shifting from that hip on the floor to the middle. 1, 2, 3, keeping the back straight. 4, don't forget to breathe. 5, 6, 7, and the last one, 8. Let's stay here in the middle, come down on our elbows, maintaining the straight back, And we're gonna take a few deep breaths into that hip at the front, into that glute. If you feel like you don't feel the glute, you don't feel that stretch in your front hip, you can always adjust the angle, bring your foot a little bit more forward, and then you will get a more pulling sensation there. Don't forget not to round your spine, keep the back straight. Let's take one last deep breath. Perfect. Before we move to our next exercise, please take a few sips of water. It's nice to get some hydration, send it to the tissues that we're stretching. And the next exercise is going to be glute bridge. I'm going to activate those glute med, glute max. Let's get to it. So we're going to get the position of supine position, so on our back. What's important about this position, the right way to do the glute bridge, that not at any point we are overextending our back. Our pelvis always tilted forward, core is activated. So what I don't want you to do, I don't want you to come up here, sacrificing the form here. No, throughout the whole movement, the pelvis is tucked forward. So we're gonna start in the position of bringing the pelvis forward. You can feel how your lower abs activated here by applying pressure right next to your hip bones right here. Usually we can achieve it by exhaling, and you should be able to feel the pressure here. And let's start the movement. We're gonna come up, making sure maintaining that posterior tilt throughout the whole movement. And up, 2, keeping the glutes squeezed throughout the whole time. So they are squeezed as soon as you lifted them up, you're keeping them squeezed all the way up. So it's a very, very controlled movement. We're at 3, we're gonna go for 10, 4, and usually when you reach that, when you reach the floor, it's very attractive to drop your hips, but we're not going to. Keeping that pelvic tilt all the time. Perfect, and now let's add breath. So exhaling on the way up. Add this extra squeeze. We have 3 more. Inhale on the way up, on the way down. Exhale on the way up. And the last one. And we're gonna stay up here, making sure once again to maintain that pelvic tilt. And let's pause for 10 seconds. Thinking about the glute, keeping that tension on. 7, 8, 9, and 10. And let's go pulsing, so micro pulses. Up, 2, 3, 4. Make sure you don't drop the hips at any point. 5, 6, 7, the back here is straight. 8, 9, and again we stay in here. Let's activate our glute medius and do a few abductions. 2, 3, 4, perfect. We're going for 10, 5, 6, pelvic tilt, 7, nose breathing, 8, 9, and the last one, 10. Perfect. Let's bring our hips back down to the floor. Let's bring our knees to the chest. Decompress lower back. If you felt like at some point you overextended your back, which again, we didn't do it with the weight, we didn't do it with resistance band, it shouldn't be that dangerous, but if you did so, please make sure that you bring your knees to the chest. We're gonna do amazing lumbar spine decompression routine at the end of this routine. So after we're doing our next exercise, which is a very pleasant one, we're gonna be doing, so what we've done, we released our glute, then we added a little bit of flexion to it, so now the blood is flowing into the glute. So what we're gonna do, we're gonna release it again with a myofascial release. For that, I'd like to use foam roller. Sometimes I like to use medicine ball. I do prefer hard medicine ball better because it goes much deeper in the tissue. But if you haven't done this before, it's good to start with a foam roller. I have a very standard one right here. I believe I got it on Amazon for $30-something. So how we're going to do it? We're gonna start in a seated position. Let's bring one foot to the knee, rotate our weight to one glute, and just start micro rolls, just up and down, kind of explore the area. Perfect. Shifting more to the side. Right here, maybe we wanna bring foot down to the floor. I really want you to get that glute meat, the one that we were doing with adductions in a glute bridge. Coming back to center, I want you to go a little bit lower, almost to the point of where Quadratus lumborum is, right here. This kind of movements are totally intuitive. You decide how long you want to stay here. You decide whether you want to pause. If you find, for example, you find a trigger spot right here, you want to pause and take a few intentional breaths. You can totally do so. Perfect. And let's switch the side. And rotate a little bit on the side. Slowly increasing the range, going a little bit further up. One thing that we don't want to do, we don't want to roll lower back. We only roll upper back. Again, there's special technique there. Without flaring your ribs too much. We usually do it in my courses, and on this channel I believe we're gonna have a few videos with upper back foam rolling. And again, here you want to go all the way to the side to explore the glute medius. Just a few gentle rolls. And go a little bit up to Quadratus lumborum here. Make sure you do this sideways. You never do it. We never want to do it here like this. This is very dangerous. Perfect. And the last very common reason why we have lower back pain, you probably heard it a lot, is weak core muscles, which is true. Usually muscles like, for example, psoas major is a deep core muscle that can be in overspasm state constantly, not working properly and causing this posterior pelvic tilt, can cause a lot of strain in our back. That's just one of them. Again, everybody is different, and having deep functional core muscles is very important. So today we're going to do just one exercise that I absolutely love. We do it with my clients once a week at least. So we're going to get into a kneeling position. Let me just put my roll away. I'm going to get into kneeling positions, extend leg to the side. So here what's important to note is that we want to tag the pelvis forward. We are in one plane of motion. If there was a wall at the back and at the front, we would be in one line. We're going to extend the arms to the side and slowly do the side bend, and on the exhale, bring ourselves up. So the right way, the most important thing to pay attention here is that pelvic tilt forward. I'm going to activate this muscle here. So this obliques are going to be the muscles that bringing us up. So it's important to work with breath as well. So we're going to go inhale on the way down. Exhale, bring up. Perfect. Inhale. Exhale. I'm already shaking. Like, this is how hard this exercise is. 2. Perfect. If you feel like this is too easy, make sure that you pause before you touch the floor. And you maintain that pelvic tilt. Let's do one more. Perfect. A nice progression here would be to put your hands behind your head. I like to do the waves as well. Go under, bring yourself up. Perfect. That would be the next level. Maintaining the pelvic tilt to engage the deep core muscles. Of course, the dominating muscle here would be our obliques. Let's do one more. Perfect. Let's switch the side. One leg to the side. Make sure that we are in one line. Knee to the foot, tagging the pelvis, completely flat here, completely flat here, extending arms to the side. And let's go. On the inhale, we're moving. Exhale. Perfect, that's one. We don't even put any weight on the floor. We just gently tap the floor, pause before tapping it, and come back up with the exhale. Perfect. Let's do a couple more. The last one, we're gonna move into progression. Remember the progression, we put hands behind our head and we go into this diving in, waving motion. 1. Let's add the breath. 2. 3. 4. Perfect. 5, and the last one. And 6. Perfect. And the last portion of this routine is going to be a lumbar spine decompression, which I also would like to do with a foam roller. It can be done with, if you don't have a foam roller, you can use a water bottle wrapped in a towel, or you can use a tight pillow, like you can roll a pillow. But optimal way to do it will be with a foam roller. So we're gonna place our foam roller not on top of your lower back, but to the sacrum bone right here. So upper glute area. And we're gonna slowly come down. We can even, actually, the right way to place it would be from the glute bridge like this. And the first thing we're gonna do, we're gonna bring our knees to chest and pause here for a few seconds. So allow the lumbar spine to decompress a little bit, get the tension off the lumbar spine. So first exercise here will be a 90-degree angle. We're gonna hold down to our foam roller and slowly move both hips side to side. It's like you're giving a massage to your upper glute. Again, this set of exercises right now are totally intuitive. If you want to stay here for longer, you can. So what we're gonna do, we're gonna bring one knee to the chest, extend legs straight, give this nice stretch into our hip flexors, and switch this side. Just making sure that our pelvic pelvis tilted forward. Just gonna go a couple reps per side here. Perfect. And the next one, let's place our hands on the knees, open, draw a circle, come back to center, maintaining that pelvic tilt. Note at any point we're overextending the lower back. The whole point of this routine is to decompress the lumbar spine. Get the tension off. I feel like I'm sliding. Let's do one more. You can stay here if you'd like. The next one would be a scissors exercise. So from this position, we're just gonna bring straight legs to the chest. Get some tension of the hamstrings, which is actually, they're also play a huge role in dysfunction of the lower back. Perfect. Let's stay here and just just kind of do what feels right. Again, we can do side to side movements, we can draw circles, we can play with our knees, we can do some hip openings. Perfect. So I want you to be a little curious about these movements and explore a little bit. Stay here for as long as you need. And this is the end of my lower back release protocol. You did amazing. Remember to take care of yourself. Remember to be kind to your body. I'll see you in the next video. Take care.